Hey there, health enthusiasts. In today's video, we'll be diving into the world of supplements for eye health and exploring the essential nutrients that can help you maintain optimal vision. We'll cover key vitamins, minerals, and other nutrients backed by scientific research, dietary sources, and the potential advantages of supplementation for those at risk of developing certain eye conditions. So, grab a pen and paper, and let's get started on this journey to better eye health. Now, let's kick things off by talking about the crucial role that vitamin A plays in maintaining healthy vision. Vitamin A is a component of rhodopsin, a protein that allows the eye to see in low light conditions. A deficiency in this essential vitamin can lead to night blindness and even a progressive eye disease called xerophthalmia. But don't worry, you can find vitamin A in plenty of delicious foods like liver, dairy products, eggs, and fish. And for all you veggie lovers out there, beta-carotene, which is a precursor to vitamin A, can be found in carrots, sweet potatoes, spinach, and kale. Studies have shown that diets high in vitamin A may be associated with a reduced risk of cataracts and age-related macular degeneration, or AMD for short. In fact, Seddon and colleagues published a study in the Journal of the American Medical Association way back in 1994 that found a link between dietary carotenoids, vitamins A, C, and E, and a lower risk of advanced AMD. And Shashan Tabor and her team also reported in the American Journal of Clinical Nutrition in 1999 that a prospective study in US women showed an association between higher carotenoid and vitamin A intakes and a reduced risk of cataract extraction. Pretty cool, right? Moving on to vitamin C, this water-soluble antioxidant is a real powerhouse when it comes to protecting your eyes from oxidative damage caused by those pesky free radicals. The Age-Related Eye Disease Study, or AREDS for short, found that a daily supplement containing 500 milligrams of vitamin C, along with other nutrients, reduced the risk of advanced AMD by a whopping 25% over 6 years. That's a pretty impressive feat. But vitamin C isn't just great for fighting off AMD, it's also essential for producing collagen, a protein that provides structure and support to the eye. Observational studies by Juk and colleagues in 1997 and Ravindran and his team in 2011 have suggested that higher dietary intake of vitamin C may be associated with a lower risk of cataracts. So, make sure to load up on those citrus fruits, berries, tomatoes, bell peppers, and leafy greens to get your daily dose of vitamin C. Now let's talk about vitamin E, another powerful antioxidant that helps protect your eyes from oxidative stress and damage. The AREDS study showed that a daily supplement containing 400 IU of vitamin E, along with other nutrients, reduced the risk of progression to advanced stages of AMD by 25%. While some observational studies, like the one by Kui and his colleagues in 2013, have suggested that higher dietary intake of vitamin E may be associated with a lower risk of age-related cataracts, more research is still needed to confirm these findings. You can find vitamin E in vegetable oils, nuts, seeds, and leafy green vegetables. But wait, there's more. B vitamins, particularly B6, B9 acid, and B12, have also been studied for their potential role in maintaining eye health. These vitamins are involved in the metabolism of homocysteine, an amino acid that, when present in high levels, has been associated with an increased risk of AMD. In fact, a clinical study by Kristen and her team, published in the Archives of Internal Medicine in 2009, found that daily supplementation with a combination of folic acid, vitamin B6, and vitamin B12 reduced the risk of developing AMD by 34% over 7 years in women. Pretty impressive, if you ask me. You can find these B vitamins in foods like poultry, fish, eggs, legumes, leafy greens, and fortified grains. And while we're on the topic of B vitamins, let's not forget about vitamin B3, also known as niacin. A nationwide study in South Korea by Kim and colleagues, published in the journal Nutrients in 2018, found an association between lower dietary intake of niacin and an increased risk of glaucoma. However, more research is needed to fully understand this relationship. Now let's shift gears and talk about some other important nutrients for eye health, starting with lutein and zeaxanthin. These carotenoids are found in high concentrations in the macula, which is the central part of the retina, responsible for sharp, detailed vision. They act as powerful antioxidants and help filter out harmful blue light, protecting your eyes from damage. Several studies, like those by Ma and colleagues in 2012, Liu and her team in 2014, and Chu and the AREDS2 research group in 2013, have suggested that higher dietary intake or supplementation with lutein and zeaxanthin may be associated with a reduced risk of cataracts and AMD. You can find lutein and zeaxanthin in leafy green vegetables like spinach, kale, and collard greens, as well as in eggs and corn. While there's no established recommended daily allowance for these nutrients, the AREDS2 study used a daily supplement containing 10 mg of lutein and 2 mg of zeaxanthin. Omega-3 fatty acids, particularly DHA and EPA, are also essential for the proper development and function of the retina. These fatty acids have anti-inflammatory properties and may help protect against the development of AMD and diabetic retinopathy. A meta-analysis of 31 studies by Salavila and her colleagues, published in JAMA Ophthalmology in 2016, found that higher dietary intake of omega-3 fatty acids, particularly from fish and seafood, was associated with a lower risk of diabetic retinopathy. Omega-3s may also benefit individuals with dry eye disease by helping to improve tear production and quality. A systematic review of randomized clinical trials by Molina Leyva and her team, published in Acta Ophthalmologica in 2020, found that omega-3 supplementation was effective in improving dry eye symptoms and increasing tear production. You can find omega-3 fatty acids in fatty fish like salmon, mackerel, and sardines, as well as in flax seeds, chia seeds, and walnuts. The American Heart Association recommends consuming at least 2 servings of fatty fish per week to obtain adequate amounts of DHA and EPA. Last but not least, let's talk about zinc, a mineral that plays a crucial role in maintaining the health of the retina, cell membranes, and protein structure of the eye. Zinc is involved in the formation of visual pigments and allows vitamin A to travel from the liver to the retina to produce melanin, a protective pigment. The AREDS study found that a daily supplement containing 80 mg of zinc oxide, along with other antioxidants, reduced the risk of progression to advanced stages of AMD by 25%. The AREDS2 study used a lower dose of zinc, 25 mg, in combination with other nutrients and found similar beneficial effects. You can find zinc in foods like oysters, red meat, poultry, beans, nuts, and fortified cereals. The recommended daily allowance for zinc is 11 mg for adult men and 8 mg for adult women. In conclusion, a balanced diet rich in fruits, vegetables, whole grains, and healthy fats can provide many of the essential nutrients needed for maintaining eye health. However, certain supplements may offer additional support, particularly for individuals at risk of developing eye conditions such as AMD, cataracts, and dry eye disease. The AREDS and AREDS2 studies have provided compelling evidence for the use of specific supplement formulations containing vitamins C and E, zinc, lutein, zeaxanthin, and omega-3 fatty acids in reducing the risk of advanced AMD and vision loss. B vitamins, particularly B6, B9, folic acid, and B12, have also been associated with a reduced risk of AMD, likely due to their role in lowering homocysteine levels. While these findings are promising, it's crucial to consult with a healthcare professional before starting any supplement regimen, as individual needs may vary, and high doses of certain nutrients may interact with medications or cause adverse effects. Maintaining healthy eyes through a combination of a balanced diet, regular eye examinations, and appropriate supplementation when recommended by a healthcare professional can help preserve vision and overall quality of life. By understanding the role of essential nutrients in eye health and staying informed about the latest research, you can take proactive steps to protect your eyes and reduce the risk of developing sight-threatening conditions. And that's a wrap for today's video on supplements for eye health. If you found this information helpful, be sure to visit nutritionmarket.com.au for more resources and to check out our virtual clinic, where you can book a consultation with one of our clinical nutritionists or naturopaths. We serve clients in Australia and around the world, so don't hesitate to reach out if you need personalized advice on your eye health journey. Remember to hit that like button and subscribe to our channel for more informative videos on health and wellness. And as always, keep in mind that while this content is informed by research, it shouldn't replace advice from your healthcare provider. Some scientific findings may still be under investigation, so it's always best to consult with a professional for personalized recommendations. Thanks for watching, and until next time, take care of your eyes and stay healthy.